Hey everyone, welcome to this new video. In this video, we are going to talk about an ophthalmology case. But first, don't forget to subscribe to our YouTube channel and keep the notifications on. Mr. H is a 25-year-old man working in a chemical factory. Mr. H complains of burning his eye with acids. He is sure that the substance is acid and only burned his right eye. He says he has washed it with water before coming to the emergency department. Since this is a chemical burn of the eye and it's a medical emergency, without wasting time on history taking, treatment should begin. Now let's go to the next page. Before starting, we got to know which chemical is acid and which one is alkaline. Here you can see some examples. For example, hair dyes and tints are ammonium hydroxide. Cement, plaster or mortar are calcium hydroxide. Bleach and swimming pool cleaner, they are sodium hypochlorite. Permanent hair wave neutralizers are acetic acid. Toilet bowl cleaner is hydrochloric acid. A car battery fluid is sulfuric acid. And oven or drain cleaners are potassium hydroxide. Moving on to the next page. So what should be our first step? We should start irrigating the eye immediately with copious water or balanced saline solution. The eyelid should be opened with a retractor or eyelid speculum. Continuous irrigation with water or saline is recommended until a neutral pH is achieved, and that's between 30 to 60 minutes to 2 hours. We have to remember to irrigate the furnaces in cases of cement exposure, because of more alkaline injury. If you suspect a globe rupture, the irrigation should be less forceful. You should measure the pH at the fornix. And if you're using a pH paper, a pH of 6.5 to 7.5 is considered normal, and if only one eye is affected, the other eye should be used to determine the normal pH. For confirmation of a neutral pH, remeasure pH at 5 and 30 minutes after you completed irrigation of the eye. And these are some key points and medical treatments for the chemical eye exposure. First, don't forget eversion of the eyelids and search for the remaining materials. And also, particulate chemicals must be removed using a cotton-tipped applicators or forceps. Broad-spectrum topical antibiotics should be used. Third, topical corticosteroid for 10 to 14 days. Oral tetracyclines. Topical sodium citrate. Topical cycloplegics. And remember, in the earliest stage of a chemical injury there may be a rise in IOP, which can be controlled by use of oral carbonic anhydrase inhibitors in order to avoid toxicity from topical glaucoma medications. Also remember to prescribe vitamin C, 1 to 2 grams of vitamin C per day, but should not be administered to patients with compromised renal function. And the last two is topical lubricants and a bandage contact lens. And that's all. Thanks again for watching this video. If you like this video, don't forget to like and comment down below. And also don't forget to subscribe to our YouTube channel and keep the notifications on. Don't forget to comment down below and tell us which cases should be discussed later on. Thanks everyone.